Eve and Beth Ann, this is for both of you, and it's come from the audience. Given that clinicians are critical to the success of the new funding arrangements, how can LHDs manage the, at times, conflicting perceptions and views of priorities and objectives that may exist between an LHD and the clinicians that are working within it?
Thank you. Look, it's a really important question, and I think I touched on a few of the points to address that in my presentation this morning. Education, I think, is the foundation, and knowing that we're all, in the end, on the same page and trying to achieve the same goal. And as I mentioned, clinicians' understanding of activity-based funding is actually not that high level at the moment. And so until you've got that base put down there, you can't make those next level decisions about trading off wins and losses, I guess. In terms of how to go about doing that, a few of the things that we've tried to do to engage the clinicians is to involve them in the process. And through that involvement, as I found, comes education and understanding of these processes along the way, and you develop an awareness of the other side and of the conflicting interests that management side has also to deal with at the same time. And so it's not until you have that bigger picture and can stand back and look at both sides of the equation that you can sort of come together and make these decisions. So education is really a key part to that process, and engagement and involvement of the clinicians along the way. And I've talked a little bit about the levels right from the top structure, but right down to the juniors as well is really important.
I'll just add to that. My feeling is that it's with difficulty that you get the clinicians on side. And all of those things, the training and the collaboration, are very, very important. But it's one of the major issues in our health district in terms of success. So we need to provide them with all the support they need, the training as we've mentioned, but also the systems. We have two types of clinician, the ones who really prefer their handwritten notes and the others who are dying to use an iPad. So somehow or other we have to reconcile that and make sure that we keep them all happy and that we keep the coders happy, because the quality of the data is going to be very, very important. So this issue of clinicians, getting them on side, the collaboration, the training, the understanding is just vital. And I think that's one of the I guess issues that we need to address to make this all work. My feeling is that activity-based funding is the glue that's going to make all this, the whole system, work. It fits in with our Minister Skinner's core values. It'll encourage us to collaborate. In our health district, we're collaborating with clinicians, we're collaborating with the Medicare locals. In fact, we have the CEO of Medicare locals on our board. And I think the activity-based funding, when that is actually working properly, and I have to acknowledge Mary for saying that she's expecting this year to be bumpy. I think it will be too, and it's great that our GG recognises that we're going to have a little bit of a bumpy ride. But when all that's in place, it's going to allow us to collaborate within our health districts. It's going to allow us to implement the governance arrangements properly that Minister Skinner's put in place for us. And it's going to allow us to have that transparency and openness and respect for each other. And the empowerment, which is also included in the core values, to actually do what we need to do to improve the patient experience.